Diabetes is one of the most common chronic health conditions affecting millions of people worldwide. But the good news is, with the right steps, you can do something to prevent it or manage it properly to your old age. Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, your trusted guide in family health and wellness. Diabetes has become an epidemic. It affects 1 in 10 adults worldwide and causes 6.7 million deaths globally. There are over 4 million cases of diabetes mellitus in Nigeria alone. And out of this number, 50% of the people that have this health issue don't even know that they have it until they were diagnosed. What is diabetes mellitus? Diabetes mellitus is a sugar disease. It is a health condition where there's so much sugar in the bloodstream, but not available for the cells and tissues and systems in the body to utilize. There are 2 types, type 1 and type 2. In type 1, the individual is not producing insulin. The person's pancreas, the organ that's responsible for producing insulin, is not doing its job for one reason or the other. It starts from childhood, and so the person is placed on insulin throughout his or her lifetime. But that is not the common type. The common type is type 2, and that is what this video is about. Type 2 diabetes mellitus. That is the diabetes that starts from adulthood. The person wasn't born with it. The pancreas has been releasing its insulin normally until a certain stage, where for one reason or the other it's no longer producing either enough insulin or not producing insulin at all, or it may be producing enough insulin but the body is not sensitive to the insulin. Insulin is like the key that unlocks the cells to be able to take in glucose. And you know, every cell in the body needs glucose for energy, for its metabolism. So, what happens when somebody has diabetes? When somebody has diabetes, the person is eating, the food is broken down into glucose. The glucose remains in the bloodstream. It doesn't get to the cells. It's like having food, plenty food in your kitchen. The kitchen is locked. You don't have the key to access the kitchen. You have the food, but you're hungry. That key to open the lock is insulin. So you are hungry, but your bloodstream has plenty glucose, but you can't access it. So what happens? This is what gives rise to the symptoms of diabetes mellitus. What are the symptoms? You feel very tired, very weak, very hungry, you urinate a lot, and you're not adding weight in spite of good appetite. That is diabetes. It all results from the too much sugar in your blood. So when there's too much sugar in the blood, it draws all the water from every part of your body into the bloodstream, because sugar is concentrated, it's a solid. So when it draws all the water into the bloodstream, you lose water, so you are dehydrated, and so you tend to drink more water. And as you drink more water, it draws more into the bloodstream, your blood volume increases, and that is how it can lead to hypertension. Now, as the blood volume increases, the whole load is on the kidneys to try to regulate the blood volume. And so the kidneys passes so much of the sugar and water. And so you urinate a lot, and your urine is filled with sugar. So because you're tired, you're hungry, you tend to eat more. You are eating more, and you're not putting on more weight because the food is not getting to your tissues, and your tissues are starving. And because your tissues are starving, the body tends to draw its energy from the stored fat. So it utilizes fat to make its food. And so when it utilizes that fat, you lose weight. So you get emaciated, even though you are eating so much. That is what diabetes does. Diabetes affects every system in your body. This sugar can be deposited through the bloodstream in every part it feels like. If it goes to the retina, it causes diabetic retinopathy, which can lead to blindness. If it gets to your skin, due to a process called glycosylation, it can get deposited anywhere in your knuckles. It can cause trigger finger. It can cause what they call diabetic cheroarthropathy. And that is diagnosed using the prayer test sign. The sugar is deposited around the knuckles, the lines of your fingers. And so when you get to the hospital and they tell you to do the prayer sign, now when you do prayer sign, your hands are together like this. But if you have this diabetic cheroarthropathy, your hand is like this. You cannot bring them together because of the nodules, the deposits around these lines. On the skin, it can give you skin tags. It can cause what they call acanthosis nigricans, where the flexure points in your body, on your body, like the neck or the elbow, where you can bend your, or the armpits, the skin around those areas are thickened and darkened. You might even think they are fungal infections, but they are the result of diabetes mellitus. If they are deposited on your feet, they will give you what they call Charcot's feet or Charcot's foot. On the shoulders, you have adhesive capsulitis. Your shoulder begins to stiffen. Even in the stomach stroke, esophagus axis, it will give you gastroparesis, weakness of that area. It affects your kidneys and cause diabetic nephropathy. It can lead to kidney failure. It can affect your organs and you get erectile dysfunction. You can even get retrograde ejaculation. So diabetes affects every system in the body. But what are the causes? Apart from disease of the pancreas, that its duty is to secrete insulin, you can have insulin resistance. Your body is resisting, is not recognizing the insulin. People with hormonal issues can have that. Lifestyle, if you take a lot of alcohol, that could predispose you to diabetes. If you eat junks, you eat a lot of these processed foods, you are predisposing yourself to diabetes mellitus. In fact, the incidence of diabetes mellitus is increasing because of urbanization. We no longer move about like God created us to move. Exercise, use your legs. We stay in one place and use our remotes or other robots to do stuff for us, even to sweep for us. That's not how we are meant to be. We are meant to be active. So live an active lifestyle. Avoid eating junks. Eat healthy diets. Lots of vegetables and fibers. Don't do smoothies. Smoothies are loaded with sugars. You want to eat your fruit, you want to take your orange, eat your orange as orange with the fiber inside. That would assist you, will help you in your health journey. Don't take smoothies or juice. Take your fruits as they are. Wash them properly and eat them in every meal. Avoid alcohol. Exercise. Socialize. That will help you to manage diabetes. For some people, it's genetic. If you have a family history of diabetes, you may come down with diabetes. So now you've heard how it's caused. Take precaution. You can prevent it by eating right, exercising, avoiding junk foods, and improving your lifestyle by avoiding alcohol. So let's live right. Let's take the smart choice. Let's try to prevent diabetes. Over $1 trillion is spent globally every year managing diabetes and diabetes-related issues. That money could be channeled to better causes. Manage your health properly. Share this video with people you think might find value in it. Share it with people with diabetes or people managing patients with diabetes. Share it with your loved ones. Everybody needs to hear about this. Let's be in charge of our health. Like and subscribe to this channel. I am Dr. Happiness, and together let's build healthier and happier families.